Health Nuts, episode 44. Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and today I'm very excited to have on an awesome guest, and that is one, Dr. Todd Riddle. He is a certified chiropractic sports practitioner, registered kinesiotherapist, a certified strength and conditioning specialist with 20 years of experience in sports medicine and sports performance training. Dr. Riddle was an All-Ohio quarterback in high school, earning him a full athletic scholarship to the University of Toledo. There he received his undergrad degree in exercise science and kinesiotherapy while being a two-sport athlete, playing quarterback for the Toledo Rockets and throwing javelin on the track team. His early career involved developing and implementing rehab programs in aquatic and clinical settings. However, he transitioned into sports performance due to a strong desire to work more with the athletic population. Dr. Riddle has worked with thousands of athletes across many sports, ranging from the amateur to professional. Most recently, he was the team chiro for the historic Nigerian women's bobsled team at the 2018 Olympic Winter Games in Pyeongchang, South Korea. Currently, he continues to work with winter sport athletes, specifically skeleton. Dr. Riddle has served as an assistant professor of clinical sciences at Sherman College and currently at Texas Chiropractic College, teaching rehab, orthopedics, diagnosis, and soft tissue manipulation. Dr. Riddle has served on various chiropractic committees at the national level and in an active member of several sports national and local chiropractic organizations. He is married to his wife, Jessica, and has 4 kids, Isabella, Scarlett, Brooks, and Charleston. So, Dr. Riddle, that's a mouthful, my friend.
I've been around the block a time or two.
Yeah. It's like alphabet soup after your last name.
Well, it's kind of a running joke with a mentor of mine. Most of the time you put those on there as an ego stroke, but it's kind of a standing joke between my mentor, Dr. Tom Hyde, who has an even longer alphabet. So we kind of put it on there as a standing inside joke, not as a hey, look at me kind of thing.
Yeah, no, it's good, and I'm looking forward to hearing your expertise in the sports realm. You got years and years of experience, and for the audience out there, today's going to be on sports-related injuries, how to recover from them, how to recognize what one's going on. Maybe if you're overusing a certain part of your body, he's going to give his expertise on this subject. Obviously, with him being an Olympic doctor, this is going to be someone you want to listen to, so stay tuned for the message. Before I get into the nuts and bolts of this, tell us a little more about yourself.
Yeah, so as you said there, I had originally grown up in the Cleveland area and went to Walsh Jesuit High School, for those up in that area that may know where Walsh is, and ended up going to school at Toledo. But that kind of started me on a path, and I bring up high school for a reason, because I firmly believe that I had an injury in high school that got me to where I am today. And it's kind of interesting when you work yourself backwards and try to connect the dots, that it was that injury that literally has me sitting in the seat talking to you. It was a pretty profound injury. I had partially torn the brachial plexus on my left side, and
that's a big one.
Yeah, more or less paralyzed my left arm for the better part of a year, and that kind of set me on a trajectory to want to be in healthcare. And very long story short, that got all cleared up, but I was still having some neck and shoulder pain after college. Ended up playing a little bit of arena football in North Carolina, and there was a chiropractor affiliated with the team. And some of the best advice I ever got was, hey, go check out the chiro. And within about 3 visits of some good adjusting, had all of that residual neck pain cleared up, and absolutely set me on a trajectory into chiropractic care. There was a lot of stuff that went on prior to that, but it started a long history. So that injury is literally the reason I'm doing the stuff that I do today.
Yeah, we can get into the peak performance and all this other stuff that's associated with the reaction times. That has been research on chiropractic and the things that it will show if you, especially these professional athletes you work with, they are literally working to get that 1/10 of a second better.
That's it.
And this doing that one thing maybe their competition is not doing, and sometimes chiropractic's one of them.
Yeah, absolutely. And it's so often overlooked, because sometimes chiropractic still gets stigmatized, and we're absolutely gaining cultural authority, and it's going to be a long road, but the better we can get at showing how we can improve, in this case, sports performance, the more the public will be awakened to the benefits of what we do as chiropractors.
Yeah, and with that being said, I want to dive into this with
Yeah, let's go.
a ton of questions I've got for you. So to the standard athlete out there, so most people are not going to be on the Cleveland Browns or on the Pittsburgh Steelers anytime soon.
Yeah.
So the general person that's out there, they're doing their workouts, they're doing CrossFit, they're doing their Peloton bike. They're injured, and maybe it's an acute injury. What some physical therapists will say heat, other docs will say ice, some docs will say, and it's vice versa. Ice or heat, can you put it to rest?
I put it to rest, no, because research hasn't put it to rest. What I can say is there is an individual choice there. Some people do not respond well to ice. It actually causes more pain. Some people don't respond well to heat. Now, the general rule of thumb is acute injuries, you're supposed to put ice on. With your more chronic injuries, we're supposed to use heat. Again, physiologically, I can make an argument for not using heat or using heat during an acute injury. It all comes down to the individual patient, and that's not meant to be I'm not trying to delay or put off the question. It's we need to treat our patients individually. And if a patient just like, look, I don't like ice on my body, then I'm not going to have you put ice on your body. And there are a lot of other ways that we can help somebody in the healing process. I was actually just teaching a class about this, that if your overall goal is pain relief, there's a lot of other ways you can provide pain relief than just popping a pill. You can elevate it, you can ice it, you can wrap it, you can tape it, you can put some kind of electrical stimulation on it, you can move it. So if your overall goal is pain relief, find a way that suits you the best. If your overall goal is swelling management, again, there are a lot better ways than taking a medication. Again, wrap it, elevate it. So to say that we could put the argument about ice or heat to rest, I don't think we're ready. I don't think we're ready for that yet, but I would say, generally speaking, cold for acute, heat for chronic, and that's kind of a generic answer. But there are a lot of other little things you can do in between to kind of stimulate the healing process.
And your recommendations on contrast therapy?
So what the research is saying about contrast therapy is it doesn't do really what they thought it was, that you were going to get this kind of pumping mechanism by going from hot to cold. That the research really doesn't bear out that it gives the benefit that it said it was. So I don't recommend it, not because it's going to harm somebody, but it's just not going to do what you want it to. So
for the population that is out there and they're in the workout routine, what are some things they can do on their daily basis to prevent injuring themselves?
Yeah, so that's kind of a broad scope topic. I think the majority of the ways that we get hurt is we are overdoing or underdoing. There's a balance that needs to be struck between exercise and how you're living the rest of your life. If you work an 8 to 5 job, jump in your car, hightail it over to the gym just to try to make that gym class or whatever it is you're going to, and you don't do any preparation to get started, obviously you're on a gerbil wheel for injury. So I think it's taking the proper time to get yourself prepared to go exercise. And preparation isn't just, getting in, getting warmed up, making sure you're doing your stretches. It's, are you hydrated? Have you eaten? Are you trying to work around an injury and just trying to work your way through it? So there's a ton of stuff that goes into preparing. So I think the average everyday person needs to do a better job of listening to their body if they're dealing with something. As far as prevention goes, this all still applies. Hydrate properly, make sure you're eating properly, get enough sleep, and make sure that you're ready to actually participate in the activity that you're going into. I don't think they pay enough attention to loads. I think that's why we see a lot of people getting injured with high intensity training. And I'm not going to name any specific company or program, but when you're not managing load appropriately or don't even know what that means, then you again are on a fast track to become injured because you may be asked to do something that you're not prepared to do, but you're doing it because you trust the person asking you to do it.
Yeah, that's a good point. And I'll name it because I see a lot of it here. With you being in the Olympics, and I see Olympic lifters, CrossFit, for example, they're doing, they'll be, one of their WODs is what they work out of the day. They'll be doing, saying, deadlifts for time or overhead presses for time.
Yeah.
And Olympic moves they're the most complicated movements that are out there, and they were never meant to be designed to see how many reps you could do over a period of time.
Correct.
Other descendants of the CrossFit realm, and I love CrossFit for a lot of it, but you're exactly right, determining the load of it and the amount of injuries it can produce. I've seen a couple blown discs from doing that, exactly what you're saying.
The reason we load from an athletic standpoint is to provide a specific outcome. And if you think that a little bit is great, but then everything you can possibly do in a short period of time is better, then you're mistaken. I mean, there's simple physiology at play here. There's simple mechanics at play here that if you become fatigued to the point where you can't execute a movement properly, you're going to become injured. It's not a matter of if, but when. So, for the everyday lifter, if there was one thing that they could do for themselves is, again, listen to their bodies. If you're starting to feel like, this is getting to be too much, or I'm really getting too tired to keep going, stop. That's not to say to be a wimp about it, but know what your limit is. And the people we see getting hurt are the people that don't listen to that limit.
The amount of rest for a given week for the lay person out there, I think it's common for some folks to do 4 or 5 days on, 2 days off.
Mm-hmm.
Do you have any recommendations on spreading that out? Monday, Tuesday, Wednesday, day off, go 5 days, take a day off? Is it different from person to person?
It is absolutely. It's different from person to person and workout to workout. The folks that I'm working with now, we're ramping up for season. So we're really getting after it in relationship to load and to speed. So I kind of take it on a daily basis approach. I know what I want to do that day, but if they come in saying, I'm just not feeling up to it, or I'm really sore, or I tweaked a little something, I'll modify the workouts that we can still get in what we need to get in, but I'm not going to say, well, that's too bad, suck it up, we're going to do it anyway. It's very, very individualized. And that's, again, why strength coaches have jobs, why folks like me have a job in that way, because we're paying attention to the athlete and to the person and to their physiology and where they're at.
Some signs that maybe they're overusing. What are some signs maybe the body's yelling at them, some signs or symptoms?
The easy one is pain. Pain is the big one. Constant fatigue, illness that just doesn't seem to go away, injuries that just don't seem to go away, irritability, a lack of desire to exercise. Those are some pretty obvious signs of overtraining. If you wanted to look at it at the metabolic level, you could absolutely draw blood or look at respiratory mechanisms and see if somebody is kind of falling outside of normal guidelines. So
what type of, would you be looking at inflammatory markers within the blood work, or what type of any specific tests you'd recommend at that level?
Yeah, so you could look at VO2 max. Obviously, you could look at lactate accumulation. You can look at specific enzymes you can look at. So drawing blood and looking at, and obviously it'd be best if you had a benchmark where you could look at where they were at one point and where they're at next. Now, I'm speaking more to an upper level athlete. If I'm looking at the average everyday person, it's just nagging injury that won't go away, pain that won't go away, fatigue, lack of motivation to exercise. Those are all pretty obvious things that something's up and it needs to be addressed.
Yeah, I love the one about the lack of motivation. I think that's a telltale sign, is if it's someone who really enjoys what they're doing and they're just dragging their tails to either their home gym or to wherever they're working out at.
Exactly.
That's a telltale sign that the body's telling you to stop it.
And exactly. And as a chiropractor, a lot of our practices don't necessarily revolve around just athletes. They revolve around families, and you're going to end up with kids. And I see this particularly with high school. They're really on a grind because they want a college scholarship. They want to make a team. There's some external motivation that's driving them, and they will literally push themselves to the point of breaking in order to achieve that end. So you don't have to be a sports chiro. Your family chiros probably see this stuff all the time, and if you just listen to what the person is saying, not necessarily just what they're presenting with, but what they're saying. I see with the high school kids all the time, I'm just tired. I don't want to go to practice. I don't even really want to play. I mean, and if that's not as clear as day, I don't know what is. But the average everyday person will be sitting in front of you telling you exactly what's wrong. I think we just have a hard time listening.
Yeah, the overuse injuries, with what you're talking about, I seeing in high school kids, when we were growing up, and I'm assuming we're probably similar in age, we didn't work. I played competitive soccer for years and years. You're obviously a much better athlete than I was playing college ball. It wasn't 12 months even back then. It wasn't. You weren't going year round. And now these kids are middle school age, and they're playing the same sport 12 months out of the year.
And, and you take that a step further and you look at regionally, like I live in Houston now, and the weather is pretty, pretty nice all year round. So sports can literally be played outdoors almost all year round. So yeah, there's very little off time. When I was growing up, it was football season, and that was it. That was the only sport I played. And then there was a little bit of a break, and then it was into the winter season. So whether it was basketball or wrestling or whatever, but it was always one season, a little bit of break, and then into the next season. And the sports were varied enough that I wasn't really taxing a lot of the same systems. So, I'd go from football and then play some rec basketball with my church, and just to kind of stay in shape. And then in the spring, start baseball, have my summer off, and then start right back around into football. So there's very little off time for these athletes, and it just wrecks them metabolically. It wrecks them psychologically. That's one of the biggest things I saw, was just depression and sadness and wanting to please somebody, but it wasn't working out the way they thought it was. So oftentimes we look at injuries as a physical problem, when in fact it could very much be a psychological problem. They're either faking an injury, or an injury is becoming amplified because of their psychological state.
That's such a good point, that the emotional component of the stress that's causing the injury is what they're thinking about, that their body doesn't want to do it that bad. Mentally it causes them to break down.
That's exactly right. Or, on the flip side of things, they really still are motivated, but they're injured and they can't do what they want to do. And if their identity is tied up in that sport or what that sport provides them, then again, you can see a very significant change in psychology too. And that's probably one of the most significant things I like to try to reinforce with the students I teach and the courses that I teach outside of school is, if you're just focusing on the physical side of an injury, then you're missing a very, very significant part of, what that person is. If you're really going to treat the whole person, then you have to take their psychological state into that, but then also who they are as a person outside of that sport. What do they do? Do they hang out with their family? Do they have good habits? Do they have bad habits? So looking at them as an entire person is going to give you a much better window into how to help them, if you can, than just focusing on, say, hey, your knee hurts. All right, well, let's focus on your knee and not focus on, how that knee is affecting you as a person.
To you parents out there that have the kids in high school sports, rewind that and listen to what he just said, because that is a huge, huge takeaway of how the mental can manifest into the physical injury. And that was fantastic. Going back to something you had said earlier with supplementation,
right?
Recommendation for anti-inflammatory supplements, anything you recommend to your athletes to take on, obviously it's case-by-case basis, any standard ones, any foundational ones you recommend?
Yeah. So, as far as supplements go, and I have nutrition people that are much, much, much better. And so I'll be perfectly honest with you. I do not try to be a jack of all trades. So if I have an athlete that I'm working with that needs a really intensive nutritional program, then I will absolutely kind of shuffle them off there. And with the advent of internet, it's a lot easier to do that. Some of my standard stuff, and I'll be perfectly honest with you, I try to keep it as simple as possible. If you can manage what's going on with you through just food, that's what I want to do. So if we're looking at anti-inflammatories, cutting out some of the inflammatory stuff, your processed foods, things that we know cause inflammation, would be a key starter. Adding in ththings that are anti-inflammatory, getting proper balances of fruits and vegetables, high omega-3s, good fatty acids are going to be where it starts from there. And then if we have to start adding in other stuff, that, like I said, it starts to get a little bit outside of the realm of what I prefer to do, and I'll make my recommendations from there. But externally, we have some good natural pain relievers, anti-inflammatories. I like China Gel, BioFreeze, stuff like that.
Things of that nature.
Yeah.
I'm cut from the same exact cloth you are. A lot of times people look at supplements as a replacement instead of an addition to their diet.
Right.
And patients will come in, and they'll have a list of 10 or 11 supplements that they're on.
Yeah.
They don't know why they're on them specifically. They just read a label and thought they were all good. And because they're a supplement, they have no counteractive effects within their body. And we know just digestively, it's still got to go through all the detox channels that medication does.
Exactly. And, if you really want to get down to the brass tacks, how good is that supplement in the first place? Because there's not a great there's not a great deal of quality control on those. So to say that I'm taking this supplement, well, that's great. Do you know why you're taking it and where'd you get it? If you're getting it at one of the large box chain stores, there's a very, very strong chance that you're basically just buying a capsule or a drink or a powder full of nothing.
You're telling me that $20 gallon jug official at Sam's Club is not getting my money's worth?
Probably not.
I would agree. Couple of things moving on here. With your knowledge and your expertise and how to live a healthy lifestyle, what are some things you do within your own personal life? 3 things maybe make you a health nut.
Yeah, so that's, and I try to focus on this. I have 4 kids, so I have a lot of eyes watching me and how I conduct my life. So I try to incorporate being a health nut with my family. So we sit down and eat dinner every night together when possible. I do a lot of traveling, but when I'm in town, we sit down and eat together. Our meals are nutritious. They're generally homemade. We very, very rarely ever order any kind of takeout or, fast food. And if we do, it's very clear to the kids that this won't happen often. This is a treat. We're outside. We live near the coast, so we get down to the beach as often as possible. My kids still climb trees. They ride bikes. So we're a very active family. So we're all about eating right, getting outdoors. And then one thing I try to do for myself, and I fail at this more than I succeed at, is just be present and be mindful, like be in the moment, not just with my kids, but with myself. Because if you're looking too far down the road, then you get anxiety from that. Or if you're constantly looking behind you, you don't have the ability to look down the road. So being present, being mindful, that mental component, the mindfulness component of my overall health is definitely, as I get older, becoming more important to me. Because when you're younger, you just think you got forever and you don't pay attention to anything. The world is your oyster. And not that it's not still my oyster, but now I've got to slow down and actually pay attention to the gifts I've been given.
You've got probably the best thing you've ever done is the 4 kids, not all the certifications.
That's and when you asked in the beginning, what have I missed? What tell me more about yourself. I got sidetracked. I'm a dad and I'm a husband. I mean, that's what I look forward to getting up in the morning for, is seeing my kids, kissing them, holding them, with the same thing with my wife. It's this other stuff is just kind of icing on the cake that I get to do that. But my number one absolute goal in life is to be the best dad and husband I can be.
And in order for you to do that, you've got to put, and which our patients do as well, put yourself first and take care of you.
That's exactly it. Another one of the best pieces of advice I got was, if you can't love yourself, you can't love anyone else. And, that means a lot, different things to a lot of folks. But, again, if you're not comfortable with who you are, you can't be all things that you need to be. You can't shed your light or your gifts. So yeah, you've got to pay attention.
Awesome share. A couple other ones before I let you go.
Yeah.
You have a struggling patient that you're dealing with, maybe a patient in our office or in the area, or some of the audience members that live way outside this area, and they are either sick and suffering themselves, or they have a loved one that is. They've tried a ton of different things. They've tried to get over these injuries, and yet it's just not working for them, and they're just, for lack of a better word, sick and tired of being sick and tired. What do you say to that person?
Yeah, that's a tough one. And you know this as well as everyone else, that happens. You've got that person that walks in and says, I've been to everyone. I've tried everything. My advice right now is keep putting one foot in front of the other. Just don't stop. An answer is out there. Sometimes it's not necessarily the answer you want to hear, or you might reflect and say, I've been to everyone, and this one particular subject keeps coming up every single time. You got to change this. Well, the next person said that, and the next person said that, and the next person said that. So is it really that you haven't gotten the answer that, is going to help you, or is it they've given it to you, you just don't like that answer? And I've seen that time and again, that, they've been to this place and I got to change my diet. I got to change my diet. I got to, there's always something about their lifestyle they have to change, and that's a non-negotiable. And apparently you're not sick and tired enough of being sick and tired to make that change. And I usually say that it usually takes a pretty cataclysmic event for somebody to really circle back around and get themselves healthy. You know, they lost a loved one because of a smoking or alcohol or whatever, or they had a heart attack or they had a stroke or some kind of catastrophic event in order for them to change. And there's a great quote that runs around that, you know, if you don't have time to eat well, or you don't have the money to eat well, do you have the money to fix yourself when you're sick? So it's kind of a long diatribe there. Keep putting one foot in front of the other. Keep seeking the answers, because it is out there. I see this all the time. I get a lot of folks that come through that say, my stuff is generally musculoskeletal. So when they come through, you know, I've been to everyone. I've tried this, I've tried that. Well, have you tried this? And then we take on my specific take of it. And sometimes it works, sometimes it doesn't. It would be arrogant for me to say that, well, mine works better than everybody else's. You know, anybody that says they're getting everybody well is lying.
Yeah.
So
I always
had my failures.
I always use the baseball analogy when I get asked that, and I'll say, you know what, I don't bat 1,000, but I'd make the All-Star game every year.
That's perfect.
Yeah.
That's a perfect analogy. So the advice to them is keep putting one foot in front of the other, because you will find something you're looking for, or a light bulb will turn on, and you'll talk to enough people that will tell you, look, this is the problem. You're going to have to fix that. So
that's awesome shares. So much knowledge today, so much experience. Fantastic. A lot of truth bombs out there. From the mental component of all this plays such a huge role, and I'm so glad you touched on it. In closing, for the local Houston audience that's trying to get hold of you, or you know, with these pro athletes or these athletes that maybe some of the Olympic athletes that are out there that catch hold of this, they need to find you. How do they go about?
So right now I'm very active on social media. I put a great deal of information out there, research that's beneficial, stories, stuff like that. On social media, Dr. Todd Riddle, DCCSCS. You can find me there on Facebook, Todd14 on Instagram, and The Sport Chiro on Twitter. And then you can also catch me at factor-store.com. I also do a lot of traveling to lecture about sports medicine rehabilitation, particularly using the Factor protocol. So yeah, I'm kind of all over the place on the interweb, so to speak.
And to the audience that is out there, I'll put all those on social media handles in the show notes, so you can click on there and take you right to his stuff. You have someone who just shared. You have Olympic doctor, years of experience. He's a professor as well. This isn't going to be a fly-by-night doc, so this is words of wisdom. Thank you so much for coming on and sharing your message. I appreciate it.
Thank you. I appreciate you having me.
And to the audience out there, hope you're enjoying this content. Take advantage of it. I look forward to talking to you soon. Have a blessed week. Bye now.